I see by the clock on the wall it's 5 o'clock. I'd like to call the meeting to order for the Health and Human Services Board. Roll call, please.
Julie Medeiros.
Present.
Lisa Lind.
Present.
Sean Anderson.
He's excused.
Kathy Leaf.
Present.
Dave Osmus. Greg Telejohn.
Present.
Mike Barkalow.
Present.
Deb Lindeman.
Present.
We need the approval of the minutes from Wednesday, August 17th, 2022.
Motion to approve.
Second.
Second.
All in favor, say aye.
Aye.
Maybe you could have discussion too, I suppose, but we missed that one. We have a time for public comment at this time. We'll be allowed 2 minutes for speaker. Roy, I have your card here, so.
Is this on okay? Good. So I'm here to just give a quick update on CASA because it's rather exciting. Our county is responding as best we can to the needs of the kids who have been needing to go out of their homes for placement. And I know it's a critical need here. And we've now trained in 7 advocates, and we're planning on training in another 5 this quarter, this last quarter of this year, and then another 5 the next quarter, another 5 the next quarter, another 5 the next quarter. So pretty quickly, you add that up, it's 25 to 30 advocates serving maybe as many as 50 to 60 kids. And I had the pleasure of reading the 94th page of your agenda today. And there's a topic called Children's Services there. And it says, caseloads are increasing in all areas of children's services, adding to current stressors, with an increase in children requiring more intensive out-of-home placement environments. Increased focus is also being placed on foster parent recruitment and retention. So 2 pages of a report of which we're included, the children are included. I made a remark once before that says, these children are already neglected, and I just can't have this county neglect them again financially. I've heard so many of you people say you support the effort. That's nice, but we need some financial support too for the long run. Before we get the funds coming in from the foundations, a lot of them say, once you've been around for 2 years, come back and talk to us. We have quiet ass out there, but we really do need to have support from our county. So if you can find it in your ways, I know you have well, to get to 94 pages, you have lots of pages of what your budget consists of. So if you can look at things and find something, we greatly appreciate any amount for next year, and then we can talk about that afterwards for future funding. But whether it's $25,000 or $50,000, it costs a lot of money to train these people, and they're going to serve this county, our county. So if you can work on the budget, think of CASA a little bit, not so much for us, but for those neglected kids. Thank you.
Yes.
If you don't mind, could I ask Roy one quick question?
Sure.
I don't know if we can, Dave.
Yeah, later. Yeah,
Oh.
yeah, once. But,
You can bring it up during the budget if it's budget related.
but I am 70 years old, if you ask that question.
Any other public comments? Any other public comments? Hearing none, we'll continue. Lost my page. Consideration of the 2023 budget requests. Ken.
Thank you, Chair Telejohn. So we're going to go over the requested budgets, smaller out of the way. So what we do at this part in the budget cycle is all of the departments have submitted their request, and that's what we're going to go over tonight. So we add up all of the different departments, all of the requests that they make, And I look at the amount of projected revenues that we're going to have then, and then make a calculation. And that calculation tells me that we're $1 million apart from where we need to be. So I need to cut $1 million of expenses out of all of the requests that we have. So you guys have a fifth of the budget, or, there's 5 standing committees, so technically a fifth. But we're going to go through this, and out of the entire county, I have about $1 million to cut. So the reason we go through this then at the standing committees is as I'm making these final decisions about what needs to be cut and what should be saved in the budget, it's a chance for you guys to give me some input and feedback on these requests and say, this is absolutely important to us, make sure you don't cut this, or this is an area that if you needed to cut, we would support that. We think maybe we're over budgeted here, or whatever your thoughts may be on it. So this is a chance for you to give me feedback in the development phase of the budget, because the next time you'll see it in October, it'll be a recommended budget that's balanced. So I will have balanced the budget by our October meeting. And then at the November meeting, it's the public hearing, and we ask that you vote on the budget at that time. So really, at that point, we've gotten really late in the game. So now is a great time to provide feedback, and any final feedback then on the decisions that I make at the October meeting can be had at that time also. But just so you understand where we're at within the process. The other thing I'll share with you then is how I read the budgets. And I think it's a good way for new supervisors to take a look at it. So each of the departments, we'll go through it department by department, and for HHS, it's really division by division. We do have a summary page here of all of HHS. But the very first line that I look at is the top line of every different cost center. So that top line is general property taxes. So you can see as an HHS summary, their budget request calls for $8,182,000 in property taxes. That's the amount of property taxes, which is, one of our main revenue sources, and the one that we have maybe the greatest control over, and the one with some of the greatest limitations. So it's very important what this number is compared to last year. And so last year that number was $7,346,000. So if we go back 2 columns, that was the adopted budget last year. So that tells me we're looking at an $800,000 increase. So that's a big number. So we need to analyze what is the reason for this increase, because we have limitations on how much general property taxes we have to spend. The other revenues are listed there. So the next thing that I'll look at, so first identify how big of a change there is. The next thing I look at is I go down to the net wages and fringes, which will be midway down on that next page. So we can see that the net wages and fringes is $17,530,000, and that's compared to $16,129,000 the year before. So it's up $1.4 million. So that's actually a larger increase than the taxes that they've asked for. There's $800,000 increase in taxes, $1.4 million increase in wages and benefits, which tells me that there's other revenue sources coming in, which HHS does have a lot of new grant money coming into that division or that department for the county. So the main thing about net wages and fringes is the department heads have no control over that. So the benefits are predetermined by other people a lot of times. So WRS is determined by the state. Our health insurance is really determined by our actuary based upon changes that we've made to the plan. And then wages are what I've projected in the budget. And so in this budget, I've projected a 3% COLA and a step increase. So a step increase averages 2%. So on average, the employees would be receiving a 5% increase with the budget numbers that I've projected here. And that's part of the reason why there's a $1.4 million increase. It's benefits and it's the wages that we've projected. If you remember budget priorities, the county board established budget priorities at the beginning of this year. And it was, the number 1 item was to fix any structural deficits that we had. The number 2 item was compensation. Considering the 8% consumer price index, one of the things the county board says, well, we need to maintain our financial wage grid so we can be competitive in recruiting employees and we can be competitive in retaining employees. So 5% is the best that I can do with this budget, but that's what is built in here. And I think we'll be able to maintain that through the cuts that I need to make. So that's the second item I look at. The third item that I'll look at then is I'll drop all the way to the bottom. So it's easy. I look at a number at the top, I look at a number in the middle, and then I look at a number in the bottom. As I come all the way down to the operating expense total, so almost to the bottom. So the operating expense total is $8.7 million compared to the prior year of $8.9 million. So they've cut about $200,000 from their operating expenses. Now, this is the area that the departments have the most control over. They're able to change all of these line items, and this is where their operating expenses are. One of the reasons I can tell you that, and we'll get into it in more detail, I think, as we go through the divisions, but one of the reasons I can tell you that you see a decrease in operating, and it's part of that increase in the wages and fringes, is we plan for about $500,000 per year in Arpa expenses. When we did the 2022 budget, we planned for those to be contract services. So $500,000 in contract services to provide different things that the Arpa dollars were supporting. What we ended up doing, though, because we couldn't get any bids for the contract services, is we hired 5 employees to do those services instead. So what was planned to be a contract service, an operating expense, became a wage and fringe. And so you're going to see a little bit of a cost shift between those two. So when you see a $200,000 decrease, there was a $500,000 decrease in one line item of contract services. So there's $300,000 increase in other areas, and all of that $500,000 was shifted to wages and fringes. So that's one of the things that's happening within HHS. So first off, are there any questions over the structure of the budget? It's very similar to our monthly financial report, which should help you gain some familiarity and consistency seeing these every month. All right. If not, I'm going to proceed into the different divisions. So our public health division, we'll look at these the same way, and I'll sort of hit on the same things. So the first thing I look at is general property taxes. Last year was $728,000. This year is $923,000. So there's a $200,000 increase. So out of $800,000 increase out of all of HHS, $200,000 is in public health. So we want to sort of analyze, well, what's going on within public health? Where are these changes coming from? So I'll go down, I'll look at the net wages and fringes. You can see that there's a $300,000 increase in net wages and fringes. And then if we look at their operating expenses were up about $30,000. So it's mostly in the net wages and fringes. And so that's something that we want to take a look at, you know, what's causing those increases. I know one of the things that we have in here is we have a new position. It's grant funded. You see state health grants went from $734,000 to $832,000. So there is a $100,000 increase in state health grants, and that is attributing to one of the new positions that's been budgeted for within the public health division. Other than that, most of the operating expenses are very similar to what they were in the prior year. So if there's any questions on public health, I'd be happy to answer those. Otherwise, we'll slide on to the next division.
Where do we see our funding or our numbers for the money that we've received for ARPA regarding our salaries and what have you for our new folks that were hired?
Well, we budgeted roughly, you know, $500,000 for the 5 different positions that were created from them for the ARPA dollars. Those are rounded off dollar amounts. The thing with employee wage and benefits, the wage is fairly set, but the benefits can be quite variable. So it depends on whether they've taken a single family plan or a family health insurance plan. There can be a $20,000 swing. So while we say an average employee costs the county $100,000, it can be slightly more or slightly less. So out of the 5, I haven't analyzed to see whether they're above or below the average. But the ARPA dollars are spread over 3 years, so it's $500,000 per year for the 3 years. All right. Moving on to behavioral health. So when we look at behavioral health, you see it goes from $1.7 million property taxes to $1,388,000. So you think, holy cow, they've done a great job, $300,000 lower. Well, maybe they have done a great job, but some of that was a shift of positions. You're going to see the ADRC has a large increase. It was a transfer of some of the functions within behavioral health to the ADRC. So Kristen's not doing a bad job, and Char's doing an excellent job. They're both doing a great job. But budgetarily, you're going to see that shift. And when we look at the net wages and fringes, it's not going to match up, but I'll explain why. The net wages and fringes went from $2.6 million up to $3 million, so you see a $300,000 increase there. That's part of those 5 positions that I talked about. Do you have all 5 within behavioral health? Yeah. All right. You have 5 positions, though. Yeah. So 5 positions are within behavioral health. So you're seeing some of that cost increase here, but overall the tax levy's down, and there's some shift going on in between. So when you have these 2 moving parts, you know, one part going up because ARPA positions went from contract to employee, and you have positions that were shifted from behavioral health to ADRC, it's hard to see that those numbers were passing each other, and netting, there's some netting out in between there, but that is happening. The other place that you'll see it then is in the operating expenses. So when you look at the operating expenses, they went from $3.2 million to $2.2 million. So you have about $1 million drop. So that's 2 decreases in expenses. You have the dollars that were budgeted for contract services shifted to wages and fringes. So we have a decrease in the operating expense, and then you have some of the operating expenses cost shifted over to the ADRC. So because of those 2 changes, you see a bigger drop there within their operating expenses. Is that all clear as mud? Yeah. See, their budget's doing this, so it does become, yeah, it does become a little complicated. So I don't know. Sometimes I don't know if I'm explaining it clearly. It seems really clear in my mind, but all right. CCS, so this was a new division that was created a few years ago based upon new state funding. And what you'll see is the general property taxes are 0. They consistently stay 0. That's because it's 100% funded by the state of Wisconsin. The fund balance applied. So the thing with CCS is that it has a reconciliation period. So you'll spend the money over 12 months, you'll submit all the expenses, and then late in the second quarter of the following year, they'll finally write you the final check to make you whole. But since we operate on a calendar year basis, there's always that money that's sort of hanging out over the edge there. And that's what that fund balance applied is basically. It's the amount of money that we expect to see in the next year that's going to reimburse us for this year.
Comprehensive Community Services.
I would have gotten it wrong. So. I'm just lucky I know what BH stands for. Yeah. So within the CCS, there's really not much change. So CCS has been rapidly growing over the past few years. This is probably one of the first years where we have not had new positions added to it and created. And so you're going to see that they're relatively flat. When we look at the net wages and fringes, you're going to see they went from $3,240,000 to $3,298,000. So all we're seeing there is, that cost increase for wages and fringes going in. There's nothing else that's, going in opposite directions that are radically affecting it. And we will look at the operating expenses for them. They went from $2.8 million to $2,779,000. So they went down by about $60,000. Very small change within the CCS program. Any questions on them? They're pretty vanilla this year. All right. Economic support. So economic support, they have a very small tax levy impact. They went from 92,000 up to 170,000. It is a fairly large increase, for them proportionately. I think when you look at all of HHS, though, they're a very limited tax levy impact. They did see a decrease in the amount of the state grants that they receive, which is really the cause for the increase in their general property tax levy support that's needed. When we look at the net wages and fringes, they go from $1,174,000 to $1,247,000. That's just, wages and fringes that are increasing there. There's nothing additional that's changing. And when we look at their operating expenses, they've actually done the best they can, reducing their operating expenses from $58,000 to $12,000 to offset some of that decrease that they're seeing in state grant monies, to keep the impact of that division as small as possible. We'll move on to Children's Services. I would say, sometimes it's a different division, different department every year that has some of the biggest challenges. Children's Services, as Roy had, alluded to in his public comments, is experiencing some of the biggest challenges this past year. And so of all the departments and divisions that we have, this is one that probably needs a little bit more focus and attention. You can see that their general property taxes is going from $3 million to $3.3 million. So there's about a $300,000 increase there. When you look at the net wages and fringes, they went from $4,050,000 to $4,256,000. So there's about a $200,000 increase. We do have, there's a social worker position that we've transferred from CCS to Children's Services. And there's, I think, 2 part-time positions that we've increased up within Children's Services. So we are trying to provide them with additional resources in order to do their job within this budget. And then the other area that you're going to see an increase is in the purchase services. So you can see they've gone from $1,690,000 to $2.2 million. So that's a $500,000 increase within the Children's Services. The purchase services is, it's the cost that we have for taking care of the kids. And a lot of those costs are court-ordered costs. We have no control of them. We're not making decisions about how that money is spent. The judges are making those decisions about how that money is going to be spent. They will court order different things to happen, and this is where that gets paid from. Wisconsin is kind of unique, where we're a child of the states, and Children's Services is an unfunded mandate by the state. The state says counties will take care of it. Any children that are within your county that need services, you are going to pay for that. And the state employees, the judges, are the ones that are ordering some of those things to be done. Other states do it differently. Other states have a state agency that does it, and it all comes out of the state budget. So Wisconsin is different in that regards. But this is one of the areas that we were just seeing, huge increases in expenses, and it's completely out of our control. And with our revenue limitations, it's a big challenge. So you can see $500,000 increase on that line item. Now we do have some additional revenues that are coming in that are helping offset that. So the state service grants, you can see about a $200,000 increase. On the Acss Revenues, there's about a $200,000 increase. We have a $40,000 or $35,000 increase on F&C, whatever that is. Faye could tell you if you really want to know. But the point is even with those other grant increases, it's about $300,000 in tax levy that needs to go up in order to balance their budget because of the amount of purchase services that we're seeing. And that's not you know, it's not a made-up number. If you look at where our expenses were through August 4th, we were already at 1.1 million for the year. And if you look at the last 2 years, in 2020, we just over 2 million, and in 2021, we were at 2.2 million. So that trend line is supporting the requests that they have within this budget.
I'm just wondering, is that reflective because more kids are needing special treatment? Is there an increase in the number of kids that we're seeing, or is it the level of care, or both? Or
Yeah, it's both. The number of children is increasing, and the expenses associated with them on an individual case or on an average case-by-case basis is increasing also. All right. The ADRC. So again, I told you before not to panic when you see the ADRC, but they go from $300,000 up to $900,000. So there's a $600,000 increase. Some of that was cost shift out of behavioral health. We had seen that their budget had actually decreased. Well, this is where it landed. It went over to Kristen's budget. So don't blame her for all of this. But there is a cost shift of those dollars over here. Likewise, when you see the net wages and fringes, we go from about 1.6 million up to about 2 million, so a $400,000 increase. There aren't any new staff. It's just staff transferred from behavioral health over to the ADRC for some of the services that we're performing. We realigned which division they're being served from. And then again, on the operating expenses, you see that they went from 500,000 up to 977,000. Really what we probably need to do on those two is add those two together and probably make a better comparison to see where the costs are. But then we also had the positions switching from purchase services to employees that also complicate it. But a large increase in the ADRC. The ADRC, maybe not quite as bad as Children's Services, unless you're Kristen. But they're also seeing some challenges too. Services for the elderly have also been increasing, probably at a faster rate than some of the other demands for services that we see around the county. So we are seeing some challenges there, and some probably additional attention is needed in that area as well. I believe there was, we made a lot of smaller staffing changes within ADRC. We went to contract services for some of our meal sites. You'll see reduced FTEs for some of those nutrition programs. And then we increased some of the ADRC aides and other positions within ADRC, nutrition manager, that offset some of that. But there's some realignment with the new management that we have in ADRC with some new ideas that are being implemented. All right, and then 4920 cost center, this is the administration portion of the Health and Human Services. They went from 1,453,000 to 1,456,000, so a very minor change there. Their net wages and fringes, 1.6 million to 1.7 million. There's really about a $40,000 difference there. It's just the normal increase that you'd see for wages and fringes for that size of an employee base. And then their total operating expenses are up about $20,000 over the prior year. Otherwise, pretty flat from where it has been in prior years. So that's HHS. We're going to go into the healthcare campus next, but I'll pause for a second to see if there's any questions on any of those divisions within HHS. Exciting stuff, I know. All right, so the healthcare campus is made up of 3 subdivisions. The first presentation we have, the 4,200 cost center, is the sum of all of those. So the one thing of note is that general property taxes for the healthcare campus is 0. So we look at this from an operating expense standpoint, not necessarily an enterprise fund standpoint that takes into account depreciation and other things. we're looking at it primarily from a cash flow, so that we know that the fees that we're charging are enough to cover the operating expenses that we have. If you look at this negative line item right here, this is fund balance applied. It's a negative 163,000. That is basically the amount of revenues that we think we're going to generate in excess of the expenses that we have. So in county budgeting, we would never show a net income. We hide it here. So we put it on this fund balance applied line. But this is basically the net income that we're projecting from the operating expenses within the healthcare campus. Their net wages and fringes, if you look at that, budgeted from 6.8 million to 7.1 million. But if you look at the prior year's actuals, you'll see that they're 4.8 and 4.5 million. So why is there such a big difference? Well, the difference is that we budget for, and we kind of plan on a full house, a full census. If all the beds were filled and we had to staff at that level, if we could staff at that level, this is what the expense would look like. We don't necessarily want to ever come in and be $1 million or $2 million over budget, and so we budget at full capacity. It's just that in all reality, we end up below capacity, but we also make sure that we manage staff at below capacity levels too then, so we're matching the revenues with the expenses. And we can see that with when we get all the way to the bottom of these, the net profit on those minus depreciation is in the positive, which means that we're cash flow positive on those the past couple of years. So anyways, matching revenues and expenses at full capacity brings us in within 163,000 a break even on the healthcare campus. We do break that out then into the 3 different divisions. We have the 4210 cost center, which is the skilled nursing. That's the traditional part of the nursing home. And then we have 4230, which is the Kitty Roads. And you know, we have a $1 million budget on the Kitty Roads, even though that is empty right now. And so that's one of the areas where we've budgeted that it would be open, it would be at full capacity. This is what the numbers would look like. But in all reality, year to date, you're seeing almost no cost going in there at all. It's because it's not currently operating. And then the third division is Orchard View. So they're about $2 million out of the total. If you look at their fund balance applied, they're about $18,000, a negative number, so that's really the net profit from what we expect to receive with them being in full operation. Any questions on the healthcare campus? All right, I only got one more cost center to dazzle you with then. And that is Veteran Services, so the 4710 cost center. If we look at them, general property taxes go from $294,000 to $305,000, so we got about a $12,000 increase in property taxes. If you look at their net wages and fringes, $271 to $283, there's a $12,000 increase. That probably explains their increase in property taxes requested. And their operating expenses are within about $400 or $500 of where they were prior. So not a lot of change within the Veteran Services division. All right, so this is the chance where you can give me any feedback.
Any feedback, Kathy?
So listening to the public comment from Roy and then knowing what we hear when I'm on public protection and judiciary as well, related to children and their placements, could it be a combination of money from both of those standing committees to provide a little funding for CASA? Because, I mean, clearly we need to advocate for children. And I know that it's not a state-funded program, but I think given this is definitely a crossover department between public protection and the courts and HHS.
Yeah, I'm a huge supporter of the CASA program, and I wish them a lot of success. But they are a nonprofit organization, and that does pose some limitations for the county being able to fund them. So I haven't asked for or gotten a specific legal opinion out of our corporation counsel. I just know a similar question posed, though, by our previous corp counsel tells me that they're probably ineligible to receive county funding.
That's too bad.
It's up to the chair.
Is it permissible?
It's up to the chair to allow comment.
Go ahead, Roy.
Use the mic.
This issue was brought to my attention. I read the Attorney General's opinion. It had to do with a court case where the Attorney General looked at whether or not a county could fund a food bank type of thing. So it was serving the county. So it's related enough for me to give it some attention. I could not easily distinguish that case. So then I thought for a while about it, and I said, well, if it can't be a donation where the county simply gifts the money to the organization, says, do your job, I would like to have Corporation Counsel, at the request of anybody else in this room, consider whether or not we could contract for services so that we would offer a half-time service of our executive director. We could write up a contract that would be for whatever the county determines to be reasonable expectations and outcomes. And that way, kind of we're more of a partnership than we are right now. At one time, the thought was for CASA just to be another department of the county. And we thought that it would be easier for us to find volunteers if we weren't a county agency. And that's proving to be the case. So far, so good, but funding has to come from somewhere anyway. So I think that might be a solution. I would agree that there's a problem with a donation. So consider that. And if Corporation Counsel could review that, maybe that's going to be an okay.
Thank you. Any other comments or anything else? Ken,
That's all I have.
that's all you got?
All right, I have $1 million on my list. I will go ahead and start making those cuts unless you guys tell me not to. All right.
Thank you. And moving right into Health and Human Services monthly financials.
I can, oh, better. Okay. Okay. All right, so the financials were included in your packet. Per my review, we're trending a lot as we have been the past couple months. You know, areas I've highlighted in the past, you know, continue to be areas you should look at and notice. See, I can't actually read that up there. Maybe I can read over here. So one of the things we had talked about in the past was like the AODA treatment fees. Those have been a little below what we had expected. We just now are fully staffed with our treatment staff for AODA. So we do expect those to kind of go up here the last few months to be where we had budgeted. But that was one of the reasons that they've been low, is that we've had positions that weren't fully staffed there for our substance use department. Similar with our ACSS revenues, which is just a couple lines below that. Again, these are our local revenues based on services we're providing. So fringe salaries, staff salary and fringe were lower, but then the revenues that they've generated were lower also. From there, I didn't have much else to report, so I was going to drop down to the health center campus. Okay, couple of things that I want to point out here. When we look at, you know, this year's revenue compared to where we were last year at the same time, we're about $388,000 higher. for the campus as a whole. So that's revenue. Yep. Actually, 433,000. Sorry, I read mine. Yeah, so revenue from this time last year to this time this year is $433,000 higher. The salary, as we had talked about, so staff salary and fringe is actually lower than where we were at this time last year. But one of the expenses that you're going to see that we didn't have previously is the purchase pool staff, so 52124. We have 178,000 there. So when we're not able to get staff hired, then we're using contracted staff. So that's a line that we haven't had to use for several years that we are using now so that we can continue to take admissions and serve the people that need it. One of the other things I was looking at here. Oh.
Question?
Is that primarily CNA staff, or?
The majority of them are CNAs, yep.
Okay.
I think we do have some pool nursing, so I think we've got probably 6 different contracts now just to wherever we need it. We did have, the state had a shared kind of contract for a while where they were providing CNAs for like a 12-week stint. So let's see right down here. So a couple of these expenses that are really outside of our control, if you look at the electricity, gas for heating, the grounds maintenance, and building maintenance, those have gone up over where they were at the same time last year. So those are just kind of expenses that are continuing to go up that are kind of outside of what Sandy's control are. We did as part of the budget process, I think, you know, in working with our facilities manager, we increased those by 20% from what they were in the current budget. As a whole, I mean, the healthcare campus, and again, back to what Ken was saying with the operations, so as far as revenues over expenses, we currently are to the positive 242,000. One of the things Ken had talked about again was our purchase services. And, you know, that's the bulk of what our expenses are. So we do keep a graph back here kind of month by month with the 3 major divisions of here's the purchase services. When you look at the graphs, you can see those up and downs. Kind of everybody got hit here in the month of July of increased expenses. Behavioral health, we had a couple placements at Winnebago, so our state institution, those are very expensive. Children's services, again, we're seeing some of those higher dollar placements. And then CCS, just because of our increase in the number of recipients that we're serving, that is always trending up compared to what it had been. So that's what I have. Any questions for me?
No questions? Thank you. Okay, next is the Health and Human Services Board orientation presentation and communicable disease update from Public Health.
Thank you, Mr. Chair. And just in following with what we did last month, following that formula, for each division that presents, when we look at the services review that we'll do after this orientation, when we have a division that's going to be looked at in terms of their mandated and discretionary services, we want to provide an orientation of that division prior to doing that review so you have a better understanding of everything that division does, and it might help you with considerations around the service review part. So public health is who we're going to have present tonight as a part of the orientation. And we had a change of presenters at kind of the last minute. Kelly Ingen is our health officer and our division administrator for public health, but she's very ill and is joining us online in case she needs to answer questions. But we have our very capable Lori Diaby here, who's a public health supervisor. Has been here for 26 years?
20 years.
20, sorry. 20 years in our public health department, so I'm pretty confident Lori knows pretty much everything about public health. So she'll be providing the orientation, and then I'll go over the review of services spreadsheet that's in your packet after that. And I just want to comment before Lori gets started here, because I'm sure everybody loves when I comment, but I just wanted to say that public health is sort of my passion as I went back to grad school to get a public health degree. And the reason for that was as a clinician or working in a nonprofit setting where I was before coming to county government. I always felt like there was a patchwork system of healthcare, right, that didn't talk to each other, didn't cooperate well, wasn't well integrated. And I thought, how do you learn how to put a complicated system like that together in a way that makes sense and better serves populations? And in my area, it was behavioral health, community health, that sort of thing. So what I did was I went back to grad school thinking, well, I'll get a public health degree, it'll help me career-wise. But what I actually did was it helped put those pieces of the puzzle together for me. It helped me to see how systems that serve populations could work together and work in tandem to create better health for people. And public health, when you try and define it, is hard to do. It's a combination of things. It's a wide variety of professions. It's a way of thinking. It's preventive care. It's a whole number of things, environmental and social equity, all of those things. So I probably talked more than I meant to, but I just wanted to kind of explain my interest in public health, why it fits with Health and Human Services by better targeting interventions to particular populations to help with those specific health needs of people in any locality. So with that, I'll turn it over to Lori and let her do the actual orientation.
Okay, I'm on. Is Kelly out there? We'll see if she pops
Yes,
in.
I'm.
Okay.
Yep, I'm here.
Okay.
I'm here. Thanks.
Okay.
Thank you.
Just want to make sure that you are hearing. All right, so for the public health overview, we're going to start out with this slide. This is more about kind of what we think of when we say the word health. We're not just talking about absence of disease. We're really talking about, in public health, when we think of health, we think of the overall well-being of people. That includes their physical health, their mental health, and social wellness. It's kind of a combination of everything. And the factors that influence health and influence public or health outcomes, they refer to them, there's different terms, you know, health equity, the determinants of health. And this slide is sort of showing kind of the root causes or upstreams root causes of health. You know, it's not just someone being sick. It's the root causes, including education, healthcare, et cetera. So that's what this slide is about. And then just as a, you know, public health is a division of Health and Human Services, so we're located up in New Richmond for those that are new board members. Local health departments are the center of local public health system. We're responsible for health and well-being of everyone. We always talk about where people live, work, and play. And we talk about the 3 Ps of health, which is protect, promote, and prevent. And we provide provide us with a healthy community to keep us out of the doctor's office. So we do a lot of community work. This slide here is kind of in 3 chunks. First, on the left is our organizational chart, and it shows the number of FTEs and the positions that we have. I believe we're at 18.5 FTEs in our department. The second block the first upper block on the right those are the state statutes that give us our authority and scope of the work that we do within public health. And that fine little words down in there talks about the makeup of the board, of the HHS board, the structure of the board. This Foundational Public Health Services, this is a national model that kind of helps, like how Bob was saying, that, you know, public health is complicated because we're doing lots of different stuff. And this is a model that we're using that puts our foundational services into 5 buckets, and then our capabilities are listed below. The next few slides, I'll go into a little bit more detail of what those foundational health services are, who is doing that work, and what type of work is in each of those 5 buckets. So one of those buckets is communicable disease control, and the people that are working in this area are public health nurses, sanitarians, our epidemiologists, and we have also a program support associates. Communicable diseases are divided into 3 categories. They're either Category 1, Category 2, or Category 3 disease investigation. Some of the other types of disease investigation we do is tuberculosis. Also in this program is our childhood immunization program, as well as our adult immunization program. This doesn't include everything that's in these, but it's kind of a high-level overview of what. And then in the chronic disease section, this work is done by public health nurses, as well as we have a public health educator now. And some of the things that we do is tobacco prevention. Also in this category would be our Healthier Together and our community health needs assessment and health improvement work. A lot of our coalitions within the community that we work with. And then environmental health, we have 2 sanitarians, registered sanitarians, as well as a program associate, support associate. In this area, this is kind of my background. We have the Human Health Hazard Ordinance, which is Chapter 42, and then we have licensing and inspection programs with both Department of Agriculture and DSPS, as well as we do beach testing. We have a water program with the DNR and do transient non-community water systems, well inspections, as well as water testing. We do radon, lead. There's all kinds of things that fall in that category of human health hazards, including animal bites, and so there's a lot of different things that fall in the area of environmental health. And then in the Wic program, or Women, Infants, and Children program, we have 3 dietitians, but the total FTE, I think, is, well, it's on that chart. I don't need to go into that level of detail. And then we have program associates, and they administer the Wic program. And then the maternal child health program, maternal child and family health, it kind of includes a number of different programs, but it's the public health nurses, the health educator, the epidemiologist, and then the program associates. Included in that would be the PNCC program with Healthy Beginnings, the parenting classes, and breastfeeding initiatives. And then in the emergency preparedness response, we have a public health preparedness specialist, as well as everyone in public health sort of gets involved in preparedness. This is where we have our public health emergency plan. We activate the incident command structure when there's a big event or emergency, like we did use our ICS structure in our COVID response back in H1N1. I mean, we use that system and that structure for in response to a number of different incidences that happen in our community. In this area, we're planning for emergencies. We also exercise for the emergency. What that means is that we have these plans and we practice them, because we're hoping we don't have emergencies every day that we need to do it in the real world. So we practice to be prepared. And then the people that work in this area are constantly updating and adjusting those plans. I'll slow down just a little bit there, because there's a lot of, in those 5 buckets, in case, I don't know if Kelly, if you wanted to add something in those 5 areas.
Yeah, just the only thing I would add, thank you, Lori, great job of explaining this. I think the key thing for, maybe seasoned board members and new board members alike to know is that, and you may have heard this before, there's 86 health departments across the state of Wisconsin, and if you've seen one, you've seen one. So not every health department is the same. The model that Lori was really talking about, the foundational public health services model, really tries to provide some consistency and base foundational services so that all people living in every jurisdiction across the nation have a minimal services available to them through their local health department. One of the things, the only other thing I would mention is that we put some of our very specific programs into certain buckets, and really they could fall into multiple buckets. A good one is our rabies control program. So we in St. Croix County really kind of house that within our environmental health unit. However, another health department down the road may really house that in their communicable disease division, if they have one. You know, some health departments are very small, some are, 6 times our size. So again, local public health, the makeup is very different, and I think that's important for the board to kind of understand. Thank you, Lori, great job, and take it away on the communicable disease unless there's questions.
Are there any questions? Well, Bob has a question.
I'm sorry.
No.
Thank you, Mr. Chair. I wanted to reiterate one point about public health in terms of population health. And population is defined loosely as a group of people with at least one shared characteristic. So when we're looking at, from our Health and Human Services intervention through that lens, whether it's children's services or behavioral health or a CCS, we want to understand the populations that we're serving and the characteristics of those populations in order to design interventions that can improve the health or the well-being of those groups of people. One aspect of public health, one aspect is population health. So we look at things through, from an epidemiologist point of view, and we say, how does disease, whether it's addiction, whether it's a communicable disease, whatever the illness is, how does that behave in a community? How does it move? How does it transmit? How does it evolve? And better understand it from that point of view. Are there characteristics of the environment? Are there characteristics of the population itself that lend to certain people getting ill from certain diseases? And by having our public health division work more closely with behavioral health and other divisions, we can better understand the populations that we're serving so that when we design interventions, when we design strategies, they make sense from a data-driven point of view, from a scientific point of view, so that we're not just throwing spaghetti at the wall. We're looking at, if we design an intervention to target this population, what kinds of considerations do we need to include in that planning? It's a really beneficial thing to have our public health division and other divisions co-located for that reason alone, so that we can transfer population-level understanding to specific groups and intervention strategies. I don't know if that makes sense, but from a director point of view anyway, it's an advantage, I think, that a lot of human service organizations don't have. They don't have that perspective of population health. So I'll be quiet now and let Lori continue.
Okay, so just a little bit of an update on communicable diseases. First off, we have our COVID dashboard. I'm sure all of you probably have seen that. There's a link there to the dashboard that's on our website. You can see right now we're considered in a low category, and our case numbers are dropping. I think we're averaging like less than 15 a day right now, but it goes up and down. We maintain that dashboard, and I think it's updated weekly, so it's pretty current. You can always go out there and look and see where those case numbers are. And then monkeypox, we've had 1 case in St. Croix County. Overall in Wisconsin, there's 70 cases and 23,893 in the U.S. I think Kelly pulled this data like yesterday or the day before, so might be a little bit different today, but there's still only one case in St. Croix County. And one thing that Kelly wanted me to mention is that our hospital partners are letting us know with monkeypox when they're testing someone. So we stay in close communication with our health partners to be aware of, you know, suspect cases or things that, you know, the health partners are testing for. But so far we've had the one positive case in St. Croix County.
Deb?
Is it a category 1, 2, or 3 illness, do you know?
Kelly?
It's a 1.
Yeah.
It's a 1?
It's a
okay.
1.
That's what I thought,
Yep.
but I wasn't sure. Okay, thanks.
Category 1 for the rest of you, what that means, the different categories is, Category 1 is COVID is a Category 1 disease as well, and healthcare providers are required to report to local health departments within 24 hours when they have a positive result, and then the local health departments are the ones that, you know, in addition to the healthcare provider notifying the patient, we call and do a interview with the people and give them additional information like we do with COVID. With influenza, just so you know, the influenza cases that we get reported to us are the ones when people are hospitalized. That's the case numbers that we have. But we're right now starting our influenza clinics. We'll be doing those. We do them for community and as well as St. Croix County workers. And then earlier this spring, we had a blasto case. I think we reported to Health and Human Services about this previously, and we just wanted to give you a little bit of an update on more recent information with this. So we had 2 human cases in January, and then there were 5 positive dogs, and then a 3rd human case in March. And based on surveillance at this, well, it was initiated by a vet, noticed, you know, the cases, the positive cases in the area, but the state, DHS, DATCP, as well as CDC, they sent a team up here to do an investigation of the cases. Scroll down. This is kind of a diagram that kind of shows, I can't, oh there. There was 127 households, and what they did is they went out and they talked to each of the households and asked them if they would be willing to voluntarily be tested to see if they had antibodies if they were exposed to blasto. And we sent, we worked with the area hospital sending alert. We worked with the veterinary clinics. We sent letters. Adam helped us with this too, with some releases to the public. And the investigators went out and talked to each of the families. And so the conclusion to this point is that there were a total of 87 people that agreed to have the antibody testing. 27 of them were positive, and the state is planning to do some next steps. They're thinking about doing town halls with neighborhoods that have been impacted by this. Kelly might know more, you know, like what that timeline looks like, but there's still, this is still going on. Like they're still working on this. Yeah.
Yeah, I don't have a ton more about that. I think it's really important, Lori, if you could just, or someone who's controlling the slide, scroll up to that that second slide there.
Yeah.
I think one of the important things here is really how this was identified is there was some geographical mapping that was done with these first initial 3 positive cases, as well as the animals that the vets were seeing. So this is really what prompted this investigation, and this was a big deal. I mean, we had the CDC here, as well as DHS, and then local, our team, and that really is like the public health system, boots on the ground at work. It was really a cool thing. It was still in the throes of COVID. We were still getting lots of COVID cases, but I think it is important for the board to know people still wanted the information, and they wanted to talk to us, and they actually wanted to talk to our local staff, even versus the CDC and the state staff. Not anything against their staff; they're great, but when we were making phone calls, I think people were more apt to come forth with information if they knew, we were from and working in St. Croix County. So that was pretty cool. And 127 households, I was actually just kind of flabbergasted by the fact that 85 or 87 individuals wanted that antibody testing. So, public health, COVID is not the only thing we do. We do a ton of other things, and we don't always do the best job articulating what all those things are. So I think this is a great example of how partnership at the state, local, and national level really came together and, responded to the local community. So thank you, Lori. You did a great job. Thank you so much for your willingness to step in.
I just had a quick question. Do you know if out of the 27 people that were positive, did they have symptoms? Had they had illness, or they didn't even know they were sick?
That's a great question, Deb, and I don't think we've, I was not in that investigation team. I'm not sure if they had symptoms, but, and what that, for the board too, what that tells us is that antibodies, were likely present at some time. I know not all were symptomatic. There may have been a handful that were symptomatic, but definitely not all the positives. They were definitely not all symptomatic.
Mike, you had a question?
Yep. Blastomycosis, is that a fungal infection? Okay.
Yes, and I'm sorry we did not add that. That's a great question. Yes, it is a fungal infection. The other thing,
I had a friend that had it.
Oh, go ahead. Go
Yeah,
ahead. Sorry.
I did have one friend that actually had it, and so it's is it along the Apple River or certain areas that we've
Yes.
earmarked that it is more prevalent, or?
Yep, absolutely. So blastomycosis is kind of endemic to our area because of all our riverways, lakes, all the water, and it is found in the soil. There isn't a ton of great data on blastomycosis, and I think that's partially the reason why the CDC kind of jumped at this, because there was an opportunity here where we had some defined neighborhoods that we knew there were positive cases in. And baseline data, like the CDC finding out that 27 of those people who participated in the testing actually had antibodies for it, like they're going to put that into research, right? We won't be performing that research here, but this is ongoing on the body of research at blastomycosis. But yes, definitely endemic to wetland areas as well as rivers, lakes, streams.
Thank you. Thank you, Kelly. Oh.
Yep. Lori, just for the general folks that might be watching at home, can you give us a quick update on where we're at with the booster and flu shots and when those might be available?
Yeah, they're Monday afternoons, our immunization clinics, and you can call, we have on our website, you can call our office and make an appointment for flu shot or any other immunizations that we have.
Thank you, and thank you to Adam, too, for getting that out, some of that information out on the website. We appreciate that.
Yep.
Do we have more, or is that it?
That's
That
it
concludes?
for me. Yep.
And so now we're to review of services provided by Health and Human Services.
Thank you, Mr. Chair. So in your packets, you can see the spreadsheet that includes the services, whether they're mandated or not, the statutory or rule authority that's attached to them, a description, et cetera, and prioritizing and service level. This is a bit of an experiment for us in terms of how much detail you would like to see in these reports. Now, as we get into the different divisions, public health included, there's a large number of different services included within each division. So what we're trying to do is to as briefly as possible anyway, describe each individual service, try and attach a priority to it, and certainly any statute that would apply that would require us to provide that service. So as we look at this, I mean, I would be open to feedback as to, is this too much detail, not enough detail, or just the right amount? And you don't have to respond to that, obviously, right now, but it gets very complicated as we get into divisions, and we break apart all of the different things that those divisions do. We tried to do that in this case with public health by listing a variety of services here with all of that information that I just mentioned. I'm not going to read through it unless you want me to focus on something in particular, and since we have our public health administrator and supervisor available tonight, as well as Faye to explain any funding or expense questions you might have, this would be a good time to dive in. Again, just quickly, and we worked with Corporation Counsel too in terms of making sure that the proper statutes applied to the service. If we made any mistakes, it's not Heather's fault. We probably just made a mistake if it's not correct, but we would welcome any input around that if you see something that doesn't look right. Only one service was not mandated on this list, and it was the Child Death Review Team, which we do in partnership with the Medical Examiner's Office when there's a child death under age 19. Otherwise, they are all mandated. It's hard to sometimes assign a priority to a particular area. It feels like when you put medium or low to something, it implies it's not important. But we did try and think objectively about how we would rank these in terms of priority. And Faye helped us with breaking out the funding into various buckets here on the spending side, as well as what those expenses consist of in summary, and then what the funding source consists of. Some are tax levy, some are grants, some are a combination of grants, tax levy. It's a mixed bag there. I'll just be quiet and see if there are questions about this particular.
Any specific questions on the spreadsheet here? Kathy?
I think this is a really good model for explaining this to us. I think this is good. And then clearly it's they're all mandated services with the exception of one. But I think this gives us a perspective, especially the funding piece, so we can see that part, and I think it's a good model.
Any other comments? Everybody's happy? Next is Health and Human Services Director's Report.
Thank you again, Mr. Chair. I try to put these reports together quarterly to give you an update of where things are at in the department as a whole, and then provide a few updates from each division that might be new to you since the last report. I know we've had some discussion tonight around children's services and adult protective services, which is now under the ADRC, and the demands placed on those divisions, the increasing demands placed on those divisions and their employees for responding to the needs in the community. There's a complex sort of situation evolving in Wisconsin where St. Croix County is not alone in our challenges to meet the needs of children and families. It's a statewide problem, national problem, I would venture. Part of the solution to the problem is what we all know through research and the studies that have been done, is to keep kids in the home whenever it's safe to do so, and help the family overcome some of the obstacles that they're faced with, some of the challenges that they're faced with, whether that's addiction, mental health, or it's just other kinds of needs that they might have that are contributing to the problem where kids are being removed from the home. We know that working with families to help them find ways in which to overcome those challenges is the best approach. We don't have control, as Ken said, we don't have control sometimes over whether those kids are removed from the home or not. And when they are removed from the home, then we have to find placement for them, appropriate placement for them. We don't have a choice in the matter. And when we start looking around and scanning the environment for available resources, we find that there aren't enough. When we talk about kids with complex needs, we talk about this all the time, and it's a very vague term, complex needs. It could mean anything, right? But these are often those kids who are exhibiting behavioral kinds of challenges where they're typically older, or their behavior is such that it's difficult to manage them in a low-intensity environment like foster care or in-home kinds of service delivery, or the kinds of available residential facilities that we can refer to. Their behavior is such to an extent that it's difficult to manage them in these lower intensity environments. So we have to look for a higher intensity environment, that is a facility that can manage kids safely with a proper dosage of intervention, having people available to monitor them more closely and work with them on behavior change, etc. Those facilities have, the capacity in the state for those facilities has been reduced. Part of that is in response to wanting to keep kids in the home. So the providers of those services say, well, the state's moving towards in-home therapy and in-home care, so why would we develop these high-intensity services if that's not the direction the state is going? They want to keep kids in the home. We're not going to develop these costly and intensive service models. So there's a lack of beds for those kids that need it. I think the good news is the shift in philosophy towards trying to keep kids united with their families. That's a good direction to go. It's a good goal to have. Getting there is a challenge, and that's where we're at this point, is making that transition from placing kids in out-of-home residential settings, transitioning from that to keeping kids in the home. Well, during the transition phase, you have to do both things. You have to find kids safe places to go, and you have to try and do extra efforts to keep kids in the home when you can. And some of that process involves working with the courts, with the judges, working with foster parents, working with the state, and helping support our efforts to do that very thing. But in the meantime, recognizing the fact that these out-of-home placements are very costly, sometimes out of state, because there are no facilities in Wisconsin. So we have to sometimes place kids in other states, which is very disruptive to the family, and it's also very costly for taxpayers. In Children's Services, we've been able to hire 3 limited-term employees to assist us. We've had some turnover in that division. The work is very demanding, and that's it's not unusual to see high turnover in positions like this that are very demanding and where there's secondary trauma from the work they do. But we've been able to hire 3 former employees to help us temporarily in this area. We've been able to pay for that through the vacancies that have existed throughout the year in that department. So we're using the savings from the vacancies to help fund these limited term positions, to help the division stabilize and to help the new staff get trained, give them a little breathing room. Likewise, with adult protective services, we're seeing an influx in the severity of cases showing up in Kristen's division, the increasing number and severity, which is straining our existing staffing pattern. Again, we're always looking for solutions. We're always looking for ways in which to better serve these populations without relying on additional staff, which isn't an option right now. But it's a challenge, and it will be for the foreseeable future. Let's see, I won't read over the whole director's report. I would say that our overall, as a department, our overall focus is on early intervention. It's on preventive care. It's on those upstream solutions that Lori mentioned. It's taking a philosophy that if we can treat illness, if we can treat conditions before they become acute, then we can prevent people from going to the hospital, we can prevent them from going to jail, and we can treat them at a lower level of care. It's providing the right level of care at the right time for people in our community. And we are, examples of that include the Arpa funded initiatives where we're sending case managers into the community to work with people in the environments they live and work in. We're seeing it through our peer recovery support positions that we're contracting for. So those peers can work with people who have lived experience, can work with people with those same kinds of challenges and help them develop recovery plans. And we're seeing it, of course, here in the Government Center and working with the criminal justice involved population and trying to help them better connect with resources before they end up in situations that are more severe. So it's trying to go upstream of the problem, address the problem early before those conditions create acute kinds of needs that we typically refer to as crisis services. Any questions about any of that? I'll just go into division updates. Okay.
No further questions?
Just a couple of updates then from our division managers. The records division, we're busy upgrading our electronic health record. Part of that upgrade consists of creating a client portal so that clients can access their electronic health records more readily. That's part of the 21st Century Cures Act requirement that healthcare providers allow for that kind of access to medical records. And the Economic Support Division, there's a couple of updates there. There's a federal public health emergency in place that allows people receiving health benefits who are eligible and receiving health benefits and food share benefits to retain those benefits throughout the duration of the public health emergency. So they can't be removed from receiving those benefits under this public health emergency. However, when that public health emergency ends, which is anticipated around the first of the year, the economic support team will have to do a review of of people who are eligible for those benefits at that time to see if anyone no longer is eligible for food share or health benefits. And then at that point, they would be removed from those benefits. And our intention is, with the state and with our partners through the Great Rivers Consortium, is to inform people ahead of time, give them as much notice as we can if we think their benefits will be affected, and try and find alternative supports for them. Again, this public health emergency has been extended a few times, so at this point it's looking like around the first of the year it will end, and some people will not be eligible for benefits that they currently receive, either because their income went up or their situation changed to the point where they're no longer eligible. The other change in the Economic Support Division is that the Wisconsin Heating and Energy Assistance Program, or WEAP program, we were serving as the administrators of that program and working with WESCAP as a provider. The state wanted to move towards having a direct contract with the provider, in this case WESCAP, so that administrative duty that we were serving we're not serving in that capacity anymore. The state's contracting directly with WESCAP for those services. And the last thing from that division would be that there's a a CMS, Centers for Medicare and Medicaid waiver. It's called the 1115 waiver, that provides some additional benefits for childless adults, healthcare benefits, some assistance with short-term stays in institutions for mental disease or IMDs, things like that. The state of Wisconsin has put forth a application to extend benefits for that population, and they should know by mid-November, I believe, if those benefits have been extended or not, as a part of that 1115 waiver. Children's services, I've talked about that. I think we've all kind of outlined the challenges there. Again, caseloads are increasing. The severity of cases seem to be increasing, at least that's the perception, and it's not just us, but statewide. Everyone is scrambling to find solutions to this, us included. And I commend, actually, I want to just take a minute to thank the Children's Services team who just persists and sticks together and works together to make sure that these kids and families are taken care of in spite of any challenges that they're faced with, staffing or otherwise. And they just, their dedication and their service commitment is just amazing. I really commend them for that. CCS, or Comprehensive Community Services, their enrollment's going up. As Ken said, we moved one position from CCS that was vacant to Children's Services, to Children Long-Term Support Services, to help with that division's needs. And in spite of moving that FTE over, CCS continues to increase their enrollment to the highest it's ever been, actually, at 149 consumers, with 16 people pending enrollment, going through the process of enrollment. In behavioral health, I would like to welcome Katie Robinson, who's accepted the offer as a behavioral health supervisor. This is the position that Kristen Newton vacated back in January of this year. So it's been sitting vacant for a long time, and we're happy that Katie will be joining us. October 10th, I see, is the date that she will start. We'll welcome her. And Alyssa Tolman-Bruner is transitioning from CCS to be a social worker under our behavioral health division in the jail, and that position is funded through the opioid settlement dollars that the county received. So that position's funded, at least for now, for 18 years. And that social work position in the jail will assist children's services in some ways too, because that position will be able to help kids that are maybe 17 years old that are in jail, help them get connected to resources without with that kind of support, then hopefully help them transition to something that will help them out upon their release from jail. Let's see. And the ADRC, I wanted to compliment that team for on their aging plan, which is a huge document that outlines the goals and objectives for the ADRC. It's called the Greater Wisconsin Agency on Aging Resources. I believe Dave is a board member, am I right? And the executive director of GWAR, how it's known as GWAR, made the comment to Kristen that her team is, and their aging plan demonstrated that they're the best of the best, to quote the executive director, which is quite a compliment given that these are statewide programs. We do have an elder benefit specialist who's on leave right now, so we have one elder benefit specialist who's new and doing the best she can. So I think that was part of Kristen's updates, I think, just to say, hang in there. If there's a delay, it's not, we're doing the best we can with that. And on the healthcare campus, just one quick note there, as Sandy said, that they celebrated Assisted Living Week with special events for residents and staff, many admissions and discharges with increased demands for rehabilitation services. So their business is picking up as well. That's kind of the updates I picked out of what the managers provided me with. And again, I would be open to any questions or you may have.
Any questions for Bob? Thank you, Bob. Very good. Any requests for future agenda items? Okay, we'll make them up then as we go. I have an announcement. Because of Dave Austin's greatest personal awards today, I guess, he's being mentioned twice. As the president of the National Association of Counties confirmed his position as Human Services and Education Steering Committee member. So he's part of the National Counties Association's Steering Committee. So, congratulations. Speech. No speech? Oh, I just did it. Any other announcements or correspondence? Oh, Adam has one.
I'll jump in here. I actually have a couple. Earlier, we had posted on our Facebook page, but I'll just reiterate it here. Public Health recently harvested 40 pounds of carrots from their community garden, and they had donated it to New Richmond School District's Happy Kids Backpack Program. And that program helps out kids with meals. So they work with, if you're not familiar with the community garden, Public Health, they work with a master gardener group to plan and plant that garden, and the food is distributed to people at the services center in need of food, at the WIC clinics, and at food pantries, and programs like the backpack program. So I want to say thank you to the public health team for doing that. We have a picture of Heidi with all the carrots on our Facebook page. We were talking about blastomycosis earlier. That information is available if you want to learn more about blastomycosis. It's available on our website. It's under the public health page, and we have a short URL, so it's sccwi.gov/blasto. So it's a little bit easier to find. And then it is Suicide Awareness Month. Shar and her behavioral health team does have resources available for people in need of support on our website. We also have some posts planned on our social media this month too. And that's it.
Thank you, Adam. Anything else? Well, thanks everybody for your reports and your hard work, and I'll adjourn the meeting.